On today's episode of Dealing with Life, this one I have to forewarn you. It's going to make you angry. And I'm also going to use explicitives and curse words to describe this situation. Now, if this isn't something you want to watch or that's a little bit much for you, no hard feelings, please move on to the next video. But if you are sticking around, buckle up, Buttercup, because this one is going to piss you off royally. Now, let's talk about how the algorithm, and this is something I've talked about before, the algorithm, AI, has crossed a barrier now. In the United States, in 6 states, and I'll give you those states in a moment, they're allowing AI, an algorithm, to decide who gets care and who does not get care if they have Medicare insurance. And I will say that again. We've crossed a threshold to where AI is making the decision on who gets care. Let me get into the specifics. I'll give that to you in a moment. But this is unfucking real. The reality is now we are playing with people's lives because it's all about saving a buck. You'll get it. You'll understand in a minute. You'll understand in a minute. I'm also going to look at my notes here because I want to be very accurate. As always, I believe in precision over panic. So let's jump into it. And I'm not going to say his name because this gentleman was in an article and I don't feel it's right. But he is 83 years old. He used to rock climb. He was very active in his life. And now he can barely unload the dishwasher without being in excruciating pain. His doctor, okay, now mind you, his doctor and other doctors were sold this shit up the river that, this AI will help you get appointments quicker and get your procedure quicker. Okay, well, his doctor said the procedure he needed was covered by Medicare, so he was good to go. Well, this gentleman, this young man that's 83 years old, he was denied once, denied twice, and denied a third time. Now, the third time is when he found out that it was a bot that was denying his claim. He couldn't understand this as to why. This is why I'm extremely pissed off. You have older people, and this particularly hits older people who are on Medicare insurance, mind you, in the United States. Oh, and let me go over the 6 states those are. Those 6 states are Washington, Arizona, New Jersey, Ohio, Oklahoma, and Texas. So if you live in one of those 6 states right now and you are on Medicare insurance, you're definitely going to want to listen to this episode. Older people especially are living in pain, waiting to have treatment, and they're waiting for an approval from Medicare, only to be denied, again in these 6 states. This federal program is called WISER, W-I-S-E-R. Don't let the acronym make you feel good because it's none the fucking wiser of anything. This stands for Wasteful and Inappropriate Service Reduction. Listen to that again. Wasteful and Inappropriate Service Reduction. If you are going to classify human beings with that have healthcare needs that are in their 60s, 70s, and 80s, and as we get older, we have pains, we have illnesses, whatever the case may be, and you're going to use an algorithm to dictate where we are at now. I really want you to take a look in the mirror. If you're young, you have grandparents, you have your parents, I want you to look in the mirror and ask yourself, how in the hell can I allow this to happen? Especially if you're in the United States. Now, mind you, this is going to probably go all over the world, except the Europeans have a different approach to this, and I'll explain that in a moment. Now, the doctors, they upload clinical reasoning to a portal, okay? And an AI that is run by a private tech company. Now, mind you, private tech company, this is important, decides whether Medicare pays or not. Now, the important part here in all of this wasn't voted on by Congress. They didn't approve this. There was no formal rulemaking of this issue. This was silently and quietly implemented in these 6 states. Now, I don't know if it's coming to more. You might want to go ahead and check with your politicians and lawmakers, but I'll get to that in a moment. When they did this, they found a legal side door to go through, and they walked right through it. So again, slime balls that run AI, the assholes that control these systems, are reaping the rewards. And I'm going to get into that in just a second, just one moment. This is the incentive that should really make you furious. The companies running this AI, they get paid more the more treatment they deny. Think about that. They have a financial incentive to deny your request for healthcare for a procedure you may need because they get a bigger payday at the end of the month or whenever it is. Now, if that doesn't piss you off, I don't know what will. I really don't. Because I've been talking about AI. AI, listen, you can watch any other YouTube channel that talks about AI. You can ask all of the experts, Joshua Bengio, Hinton, Jeffrey Hinton. They're warning you, telling you that all of this is going to do bad things to us. Now, mind you, it might not be like Terminator, but at the same time, this is terrible. It's your loved ones. It may be even you watching this video that gets denied the health care that not only you need, but you deserve. Where did we go wrong? Because people have been saying this, and I've been saying it myself. I think this is a new threshold, and we have to do something about this now. So this isn't a glitch. This isn't something that the software did wrong. No, this is how it was designed, and it's working the way it was designed. When you're 25 years old and you have to wait for a procedure 3 or 4 weeks extra, that's fine because you can actually handle that. But when you're 75 or 85 years old and you have to wait that extra time of 3 to 4 weeks, that's unacceptable because the body can't compensate. You cannot compensate for that. And on top of that, the quality of life, if you're in pain, come on. Europe has a different mindset when it comes to AI and healthcare. And I'm going to give you some examples because I have them here in my notes. Now, Sweden, AI helped catch 12% more breast cancer, okay, because it worked alongside a radiologist and not on its own. The key idea in that is AI helped. It didn't do it on its own. Now, the UK and Australia, AI is supporting doctors in what they do. It's not replacing their judgment. It's supporting them. And it's not standing between a patient and their own doctor's recommendation. Now, look at the stark contrast between the two, between the UK, Australia, and Sweden. And I'm sure there are other countries that don't want to overwhelm you with all the countries, but look at the contrast there. The US is allowing AI to make a decision on its own when people with common sense are using AI as a helper and a tool, which I firmly believe that's what it's supposed to be, not a be-all, end-all. And I'm going to end this video with empowerment because I believe telling you what you can do instead of saying, oh my gosh, I'm going to sit here and worry. No, let's talk about what you can do. If you or a parent are on Medicare in one of these 6 states, that's Washington, Arizona, New Jersey, Ohio, Oklahoma, and Texas, here's what you can do. You have the right to request a peer-to-peer review, and you have the right to appeal. Now, appeal it every single time because the data says right now that appeals are winning. And that's right now. As we're talking on this video, that's of right now. I don't know if it changes. I want you to tell people, I want you to tell your friends and your family, but I also want you to call your representatives. This program didn't go through Congress. That means Congress can still kill it if enough people make noise. Now, mind you, I've said that before in other videos. We have the ability to make change with our voice. And then if enough of you talk about this and yell about it from the rooftops, Congress can kill this and you might save lives. Mind you, there have not been any documented deaths because of this. And like I said earlier, I feel this is where this is headed. It's not doing it right now. People just being denied the access they need immediately, so it's delaying things. But we haven't had a death yet. But before we get there, why don't we nip this in the bud now? If anyone you know who is on Medicare in the US, send them this video so they can be aware and knowledgeable of what's probably to come in their state if it's not there yet. And lastly, I thank you for bearing with me today on this. It really upsets me because we are playing with people's lives. And if you take anything away from the videos that we've done previously and also on our website and our blog post, if you take anything away from that, because I do include philosophy in a lot of this, if you stand for nothing, you will fall for anything. I thank you for watching this video, and I hope you have a great day. See you in the next one.